So, welcome to the podcast, ladies. This is Feminine Grit, and I'm very excited to introduce Dr. Ann Czarnik. She's a medical doctor here in Austin, and I have my good friend Kristen Abell.
Hi.
Hi. We're super excited to talk to Ann because Ann has recently started a concierge medicine company. And Kristen and I have been battling the whole perimenopause space for the last couple years. It's been quite a journey, and Anne has been integral in helping us get like what we need because we've had to go to many different doctors for many different diagnoses, and it's been like the Wild West trying to figure this out. So I love to support women and their businesses, and I'm so excited to talk to you, Anne, about
Thank you.
about your journey in this space. So give us a little backstory about how you got into medicine and where you're from, how you got to Austin.
Okay, so I grew up in rural West Virginia. My grandfather was an ear, nose, and throat surgeon, still alive, 104 years old. But I did not want to be a doctor because this man never was not working, and I was like, that is a terrible life. And then finally got to college and kind of started doing EMS and realized that there are other things you can do in medicine that don't require you to be gone. Like my grandmother always said, he missed every party and every dinner. And so I really liked EMS and trained at Hopkins in emergency medicine, finished my training 19 years ago almost. And so I came out here to start the medical school and the EM residency because we didn't have them, which is kind of surprising because we're at the flagship UT.
Wow.
Yeah, I wasn't here. The first med school was UTMB. So that's how I got here 17 and a half years ago, and did that for a long time, but it is a very time-consuming thing, especially with little kids. And I had my kids like back to back right as we were starting these programs up. So stepped away from the leadership of the residency in 2019, was still teaching at the bedside, and then COVID hit. And it changed everything for lots of people. And so I think it caused a lot of PTSD for a lot of us. I think a lot of people just left the profession EM altogether. And then about 3 years ago, after COVID, sitting on my couch, eating too much, like working these like, truncated shifts, I was like, gaining a bunch of weight, and then perimenopause hit, and I couldn't do anything about it. And I was desperate. And so I found the GLPs first. So that would be semaglutide, tirzepatide. I did the semaglutide for about 3 months and lost 27 pounds. But during that journey, it was really hard to figure out, like, how do I titrate the dose up? When do I get off? Once I get off, like, can I just stop? And once I do, how do I maintain this weight loss? So I was like, if it's this difficult for me as a physician to figure this out, then there are so many people probably out there where this is a barrier for them. And everything online, like you were saying, HRT-wise, peptide-wise, all of it is like the Wild West. I was like, this should be treated as a medical issue. It is a medical issue, and we're treating it like it should be at a med spa. So that's how Amanecia kind of grew out of the GLPs and then into other things that I found that women our age were really lacking.
Right. So what is the name of your concierge?
It's called Amanecia Health. And if you try to start a new business, you will find that it is nearly impossible to find a name that doesn't already exist. And so I lived in Bolivia when I was a kid and still speak Spanish pretty fluently.
Oh, no sabía esto.
Sí, hablo.
Qué bueno.
And I use it a lot, still in my work. But amanecer means to dawn in Spanish. And so I just changed it to Amanecia because I think the connotation is nice. It's like a new dawn, like we can help you feel better and, not be suffering.
Oh, I didn't even know that. I love that.
And I
part of
love
the name.
Amanecer.
Yeah.
It's so dramatic. It's a great word.
Yeah. So to back up to your journey and like this is happening at COVID, you're home, you're not feeling well, your body's changing. Like even 3 years ago is like so much has happened in the GLP-1 space, peptides. That's like in the very beginning, I think, for the most people to know it and understand it. And there was such taboo around it like this perimenopause thing, because you're a doctor, is that how you knew that's what you were going through? Or like,
No.
okay, so
No. I love my gynecologist, but probably when I was about 42, I'm about to turn 48 in March, she said, you may start experiencing certain things. And I was like, I'm not having any of that. But it was a very brief, truncated conversation. And again, I adore her. But like maybe 6 to 8 months later, all of these things started happening, insomnia, like brain fog, just severe depression around my cycle. And then the day it would start feeling like I had the flu. I mean, it's just horrible. It's like not a normal way to live. Worsening anxiety. And then I found a book. It's in my bag. I can pull it out. It's really probably pretty helpful for a lot of women. And I started reading it. I was like, this is perimenopause. This is what's happening. So I really educated myself and started learning about, female HRT. I do some male HRT, but much more female HRT. Men just don't have the complexities that we do when they age. Like the testosterone drops, yes. The human growth hormone drops. That also drops for us. Lots of things start to drop, but we are going through this just hormonal battle. So I do a lot more female HRT.
Yeah, and I don't think that men lose their hormones to the level that we lose. It's like they vacate our body.
They leave.
They leave.
Well,
Goodbye.
and they go up and down and up
yes,
and down
and you
during
feel
this
crazy.
era that can be 1 to 10 years long.
Well, and you look at the average age of onset of menopause is 51, and most women start perimenopause in their early 40s.
Right.
So like you're saying, over a decade of just crazy ups and downs. And then I think what's been helpful recently, if you look at what happened in 2002, there was a study that was released that said that there was an increased risk of stroke and heart attack in women on HRT. So that scared people to death. It scared doctors. Physicians didn't know how to really interpret it, and it was pretty misinterpreted. The other thing that happened with that study is that it was done in women in their early 60s. So the risk of stroke, I'm sorry, I said stroke and heart attack, but it's stroke and breast cancer. But as we age, our risk of those things goes up. And if the average age of menopause is 51,
Right.
and these women were being studied in their 60s,
11 years
Yes.
too late anyways.
They have a higher risk anyway. And on top of that, now we know that if you start the HRT more than 10 years after menopause stops, it's not helpful anyway. So it scared a lot of people away from treating women with HRT for 23 years. We've been not helping women, which is not exactly shocking in the medical world.
No.
Like we don't study women.
Which is why we're all here.
Yeah.
Right.
Which book was it that you have in your bag?
Can I pull it out?
Of course.
It's called The New Menopause, and I'm not plugging for this doctor, but it's fantastic.
Oh, yes. That's
Mary
our
Claire
favorite.
Haver. She's
course.
wonderful. One of the things that I noticed when I was going through the symptoms, it's like everything.
Yeah.
It can be anything and everything. And I was like, oh my gosh, we joke about it in, medicine a little bit when someone comes in and you do a review of systems and you're like, have you had a cough? Have you had a blah, blah, blah?
They
and
check
so
every
we say
single box.
pan-positive review of systems. That's a pan-positive review of systems because it can literally be anything. And that's shocking.
Yeah.
So when you were in medical school, how much did you learn about perimenopause and menopause?
Nothing.
Okay.
So I had to go through a women's health course in the preclinical part of residency and then a month or actually 6-week OBGYN rotation and then another OB month in residency because in the ER we deal with lots of women's issues, early pregnancy complications, potentially delivering babies. So you need to be trained, but not a single word.
Right. It's like women's care stops after you had the baby. And you weren't taught anything aside
I
from
almost-
maybe
yeah.
menopause.
I don't think I was taught a word. And I actually had this conversation with my gynecologist last time I saw her just for a checkup. And I said, how much were you taught? Because this is what she does. And she's like, nothing.
Yeah, it's wild. And I just recently heard that they didn't even use female cadavers in medical school until the 90s.
Yeah, very recent.
So they just sort of lumped us
And
all
then in the
together.
last 5 years is when, if you've read The Menopause Brain, I think I told you to read that.
Yes.
It's an excellent
I'm
book
reading it right now.
showing all these different images of the difference between when you put a male brain next to a female brain throughout the life cycle.
Heard of
how
this.
different it is.
Yes.
Oh, it's fascinating. You would love it.
And I think it extends far beyond just HRT. When all the studies were done for cardiovascular disease, they were done in white men in the Northeast. Like, they didn't look at women at all.
Mhm.
So, you know, if you just look at female medical care here in this country, we haven't been studied as extensively, and we haven't had the same kind of deep dive look at our physiology. And that's why women who have heart attacks, they get missed more often
Right.
because they present differently. They present as jaw
Mm-hmm.
pain or fatigue or insomnia, which is
Which
also
is all the
scary
things
because it's
that
all
we
the
have.
things. Yeah.
Yes, and you know, Kristen, you're younger than Ann. You and I are the same age. I'll be 48 in May. Kristen, you're younger than us, and you've had, like, compared to me, you've had completely different
Right.
issues starting earlier. And I just kind of want to talk a little bit about, you know, how Ann helped you in this space
Yeah.
because you live in Colorado.
Mhm.
Yes.
And-
So Anne basically was part of my life-saving care. She might not know it, but yeah, I turned 44 and my whole world as I knew it turned upside down. And now looking back, of course, there were some symptoms, but they weren't debilitating. I could function normally. Yeah, I was a little tired and agitated, but like I just thought that was part of being a mom in my 40s with a career. Well, then I started having, on my 44th birthday was when like panic attacks just took over my entire life. I'd never had anxiety a day in my life. Like I didn't even know what it was. I thought I was having a heart attack. And then I got informed. I'm like, oh, I'm not actually dying. This is a panic attack. Like, how am I supposed to
But
live?
you feel like you're dying,
Oh,
right?
I
when you
thought
have it?
every time that like I did go to the ER a few times.
I don't
sadly.
blame you. They're horrible.
Yeah. But, and so many women don't even know what it is. And thank goodness somebody did. I don't even remember who. I need to go give them a big hug. Told me that it was likely hormonal. And that's when I did this deep, deep dive and was asking friends and friends and friends. And Lindsay connected us because she was your doctor here, or you were.
Well, I was like, you know, wanting to learn more about the GLP-1
Oh, yeah.
space, but I had already started on testosterone
Right.
cream, and you said you were only getting pellets.
Right.
And I knew, like, so I'm like, you need to talk to Ann because she's a doctor in Texas. So I just thought that Colorado,
Right.
you
and
know,
I had to piecemeal my entire care together.
Mhm.
That's why I was so frustrated. Is like, I did all the homework. I watched all the podcasts. I was very informed compared to the average woman. And like, I couldn't get the help that I needed. So that's how fast forward 14 months and we got connected and you were finally able to get me the correct
Form and dosage
of testosterone and progesterone. And then obviously you can get me estrogen too. I just already get that through my OB, but it was like the combination of me putting all the pieces together, which took 14 months of me like really, really, really in a bad place mentally, which I didn't even know how to deal with it. And yeah, so thank you for taking care of me and now some of my friends. And she's just,
it's a fun space to be in because, you know, I love emergency medicine, still do it a few shifts a month because, you know, nobody wants a rusty doctor. But this is in all spaces, the GLP space, the hormone replacement therapy, even, you know, we do telemedicine visits for like simple things. But we also realized, my partner and I, who is in Houston, we have a Dallas location, we have a couple docs in Austin, we have a Houston location. We realized we could do so much of what we already do in the ER at people's homes. And eventually we'll probably have a physical space. But right now, like, you know, someone who's sick and throwing up and feeling terrible, like they don't want to get out of bed. So I just go to them and fix it. So
through
it's
that, do you
evolved
only
into-
do cash? currently?
So
Or do you
currently
do both?
we're pretty small. We do take FSA and HSA cards. The some so two of the docs do some Botox and injectables and things like that, but you can't use your FSA card.
Right, right.
Mhm.
But for everything else, you can use your FSA or HSA, and then it's basically pay as you go. So we the two founders, Lauren Levitt and myself, when we were thinking about like what would be a boundary for us to use concierge care, one of those things was a monthly fee or a yearly fee, and so it's very much pay as you go. You don't pay us a monthly fee; you only pay us if you need us. We've done our research about like competitive pricing, and we've tried to make it pretty
Mhm.
pretty competitive. But the thing you get with us that's different is that like if you call the number on the website, it's going to come directly to my cell phone.
Right.
So we answer the phone
Mhm.
all the time. You're not going to be like sitting on a portal waiting for a message to be, returned, or if you have an issue that comes up, most of my patients will text me or
Yeah.
call me.
But is it like word of mouth right now? Or
It
you
has
all-
been.
Okay.
Going back to the insurance issue, like if people want, we will, give them a super bill that has everything, and then they can submit it to their
Mhm.
insurance towards their deductible, or, so we do that. But right now it is all cash pay. We're just really small.
But
We've tried to keep it cheap enough that people like don't feel like it's a barrier and they want to use us because it's, if you called me, in an hour when we do this podcast,
Right.
and I'll be there. Like I'll
Right.
put everything else
Right.
down and I'll come
Right.
take care of the problem.
Yeah, and I've texted you many times, and I think that's amazing that you can get that direct care, because sometimes it's just a simple question that people
Mhm.
have. And, also the other thing about this is that the meds can be delivered to your doorstep, and like sometimes you could even overnight it if you wanted to pay the fee, but it's amazing that you can get what you need. I mean, that's how we've navigated the space, the
She just sent
compounding.
me the overnight this week because I was worried that I was going to run out to come here, and we can't have anyone running out of their testosterone cream.
Exactly.
Yeah, and that's also the relationships we have with our pharmacies. Like we had that conversation. I texted the rep. I was like, "This has to go out tonight." Spoke with a pharmacist to make sure they had it in stock, and they're like, "Okay, yep, we're
Yeah.
sending it now."
And it was there the next morning.
Yeah,
Pretty crazy.
the other thing is that, Kristen has been married for a very long time. You've been married a very long time. I'm single. I was married for a long time, but as you navigate this space, there's a lot of like women, there's a stigma around this part of your life. And I think women carry a lot of shame, and it's hard for them to talk about. I know for me, it's like I didn't want to talk about it around my boyfriend because I thought that meant that I was going to, he's dating a dried up old lady.
Yeah.
And it's like one thing I do know about men is they don't really care,
No.
just as long as you're nice to them.
I mean, the value that we tend to have in society is childbearing, and then
Yes.
after that's over, it's like, well, what am I here for? Like, it's this in between.
Yes. And as an empty nester this year, like it's so interesting that before I started on HRT, I was really starting to feel like, okay, my life's over. I need to slow it down. How do I plan for retirement? Because I didn't have the energy. I had brain fog. I just really felt like slower than I ever had.
Because your brain
Yes.
was truly
Slowing
operating
down.
slower. So you're not
Yes.
just imagining it. Yeah.
Right. But it put me into this whole other space of thinking. And then what has happened to me is now that I have this and I feel like so good, there's still things I have to navigate and tweak. That's just going to be part of the process. But I have like my brain back, and realizing that this is really the beauty of being a woman, is that you get to the place where your kids are self-sufficient,
Not quite there yet.
Yeah,
but
me
but you're not babysitting 24/7.
No.
It's like you have more freedom, and then really like this is when everything is possible. All the wisdom that we've gained, all this knowledge, we can take it and really change the world with it, which is so exciting that you've started this business at this time in your life and can really help women. But that's what we're finding is like we're feeling better, like we're on fire. We want to help women navigate this space and understand it. But since you started this, have you been surprised at like what people's needs are? Like, did you think that, okay, I'm going to be here for, what did you call it? Like basic care. What's that called?
Just like, urgent care, concierge kind of
Yes.
thing.
And then it's like kind of been more of the HRT or the GLP, like,
It's been backwards. So it started as the GLP because I, again, like, through the pandemic, started putting on a little bit more weight and a little bit more weight. And then my hormones changed. I was working out with a personal trainer, essentially like starving myself, not doing everything I could to try to lose weight, and nothing was working. And then the GLPs got the weight loss indication, and I was in the hospital looking around at all these nurses, and I was like,
Everyone's so
why are
skinny.
you so skinny? What is happening here? And they're like, Dr. Czarnik, come on now. Like, how do you not know?
Yeah, how are you not self-prescribing here?
So I ended up going through an online company
mm-hmm.
to get at the time it was a semaglutide, which is Wegovy or Ozempic, but tirzepatide, which is in my mind a way better medication. It's just fewer side effects, like, works well, you don't feel bad. But at the time, the only choice was semaglutide. And I was like, I don't care if I feel bad for 3 months. I'm getting this weight off. It took me about 3 months and 1 week to lose 27 pounds. And it stayed off.
Mm-hmm. It's like all the inflammation and bloating that
Right.
this.
And it's also, it gets rid of the central fat, which is the active fat that's bad for us. It's
Like the visceral fat,
the
right?
visceral
Mhm.
fat. It does a lot of other things that we've now found out, like they're anti-inflammatory. They help with like craving, so alcohol addiction, drug addiction. We even have patients who take it for like shopping addiction. I mean, because it does partially inhibit dopamine feedback in the brain, so you don't get that dopamine hit when you eat that piece of chocolate. You're
Yeah.
like, that was good, but I don't need another one.
Right.
Shopping addiction. That's an interesting one.
Mhm.
I hadn't even thought about it for that.
And I, personally, I have autoimmune disease called ulcerative colitis. And in the spring, NIH released some studies that show that they also block inflammatory cytokines, which are involved in autoimmune disease. So what I do now, and what I do with most of my patients, like we do active treatment to get to your weight loss goal. And when you're there, we'll stop
Mm-hmm.
and we'll do maintenance, and it's very patient dependent. So my patients do every 12 days. Some of them do once a month like I do. Some do nothing for 6 months, and then I'll hear from them.
Mm-hmm.
They're like, Christmas and Thanksgiving are coming up. Get me back on them. I do once a month because it helps with my autoimmune disease. It helps control that. And I've tried literally everything, like every medication that you can think of, short of going on an immunosuppressant, which I do not want to do. And it's the only thing that has really kept this at bay.
Wow.
Well, there's so much talk in the peptide world with the autoimmune diseases, and I think we're just at the beginning stages of learning how much they're going to be able to help.
Yeah, and
positively.
we're going to have another one probably released in 2027 called retatrutide, which is supposed to be even better, especially if you have a higher amount of weight to lose, or if you've got fatty liver, we can reverse that.
Mm-hmm.
And fatty liver now has surpassed alcohol and Hep C as the number one cause of cirrhosis and liver cancer.
Oh, wow.
So these drugs are reversing that,
Yeah.
which is amazing. And so it started out with that.
Mm-hmm.
And then we started adding, as I went through this perimenopause thing, I was like, oh boy, we got to start looking at this. And then we added the peptides and we're not talking about like the bro bodybuilder stuff. We're talking about like precursor to HGH and AD, the things that we make in our body that start to drop
Mm-hmm.
as we age, both men and women. And then arose this idea of like, well, why should we not be doing telemedicine or going out and going to people's homes and treating them in home? So, I have like some families that I see them every week.
Mm-hmm.
And some people just use me when they need me. And so I would say it's probably like at this point about 60% GLP, HRT, and peptides, and about 40% telemedicine and in-person visits.
Yeah.
So
So you have someone in most major cities
in Texas,
in
we have
Texas.
Dallas-Fort Worth, a
Okay.
physician there. We have a physician and a PA in Houston. And then we have 2 doctors and a PA here in Austin. And we just hired a nurse in Houston to do IVs. Eventually, I'd like to, the idea is to continue to grow, which means we'll have to hire more and expand our practice. So, but, in a year, what I've realized, you asked the question, is that it is so hard to get access to care quickly. And I was just talking to a friend on Tuesday about this, and she's like, I call my primary care doctor because I need a blood pressure refill, and I don't hear back from them, and they cancel my appointment, and then I have to schedule, and it's 8 months from now, and it's very frustrating. And I was like, well, why aren't you using me? Like, we know everything about each other anyway. Like, it's not like it's a secret.
Right.
And she's like, you can do that? I'm like, Erin, look at my website. Like,
Right.
Yes.
so,
Yes.
But that's exactly what happened to me when I was going through the worst, month of my life is my old primary care because I was healthy. I called and was like, I've never needed you more. I need to come in. And they're like, well, I'm so sorry you haven't been in
We're so
4
full.
years. So you have to be a new patient. I'm like, no, I don't think you understand. Like, I was at the ER yesterday. This is the only time I need you. So the telehealth is so great for things like that, where you can get immediate care and not necessarily have to go to the emergency room when you don't need to.
Especially when you're dealing with flu season, viral symptoms. Right now, this is all for me, cedar. I'm not sick, but it's allergies. But I just got a text message from CVS that was like, if you haven't gotten your flu shot yet, you should get it. Rates are rising. And so, it's also not having to go sit in the waiting room with other sick people. And, that's not something I want to do.
Yeah. And it's also like telehealth, which means you don't have to see the person. You can either do it over the phone or Zoom, I assume, right? Like with your...
Yeah, if it's simple, right?
Yeah.
Like if it's, I've had 1 million UTIs and I know exactly what this feels like. No problem. We can get the, bladder spasm medication, antibiotic in right now. If it's something more complicated, like I mentioned, like, you've been throwing up all night, can't keep fluids down, then that's something that I actually have to go start the IV, give fluids. I'll usually give, Zofran, which is an antiemetic. And then just depending, maybe some B12, because everybody's also deficient in B12. If you drink it all, it's just not easy to absorb in the gut through our diet. And then, if I have been doing EM for so long that if I see something that I'm like, this needs to go to the hospital, or I hear something that worries me, I'm like, go to the ER. Like, and it's sometimes hard for me not to give unsolicited advice.
Right.
Like someone had, who was a male, who's a little older, had some risk factors, and was having some GERD, but was just a friend, like, or hanging around. And I would be like, it's not, you need an EKG.
Right.
You need to go to the hospital. And you can't do that, right? You have to be careful with, like, how you can't be too pushy with people.
Right. But like helping us navigate, get Kristen what she needs, like that stuff that you can assess over the phone.
Yeah.
You can use your best guess and try things.
And we can, for HRT, there is, for perimenopause, it's tough. And you probably know this, that there's anti-Mullerian hormone, which can help kind of tell us where we are. Free testosterone is actually helpful because it's an absolute number. But in every other way, in perimenopause, estrogen levels and progesterone levels are like all over the place. They're up, down. So it's not as helpful. So it's almost like doing a little trial and error.
Yeah.
With dosing, the form. And so a lot of people don't know that. And
right. And what I've learned is that you kind of have to go off the symptoms and not the blood work.
Yes, 100%.
I've had people tell me, like, my OBG, you just need estrogen. And then I've had people say, that's the last thing you need. You need testosterone and progesterone. And, something that I've just from my own research is that, a low dose of estrogen won't necessarily hurt you during this up and down phase because your body is cycling so much.
Yeah.
So it's really symptomatic.
It is. And so I'll give you an example. So I started the progesterone first, which is what I usually do, unless the patient's having like really active vasomotor symptoms, like, hot flashes and night sweats. And because that's very much estrogen based.
Yes.
So I started the progesterone first, and I don't treat myself. I let my doctor treat me. I don't think any doctor should be their own physician. And I called her up the other day and I said, it's not enough. Like, I am like very depressed around every month, like, and it's getting closer together. So it's like every 24 days and I'm feeling like horrible and down and like the whole world's just awful. And then I feel like, the flu symptoms the day of are getting worse. So she started me on low-dose estrogen about 2.5 weeks ago. And I already feel better.
Like the patch? Like the
I'm doing the
transdermal?
patch right now. I mean, there are other ways to do it. You can do an injectable form, like where you insert it. And then the patch, the only thing that bothers me is you get this like little glue sticky stuff on your skin.
Right.
It's hard to get. It's like the stuff at the hospital when they put the
You
sticky.
can just do the loofah.
Yeah.
Yeah, I have to loof it off.
Yeah.
But so far it's made a difference, I think.
So you could tell, yeah.
I can. It's been a few weeks.
Mm-hmm.
And you always have to sit there and think, okay, is some of this placebo effect? Because placebo effect is extremely powerful. If you tell your brain this is going to help me, you'll get a lot of effect from that. But I'm kind of out of the placebo phase. And I
Yeah.
feel like it's making a difference.
Yeah.
Well, I
That's
can
great.
tell you firsthand, I believe in the placebo, but I also know that if you forget your patch,
You will know it.
because when I was in London and they lost my bags, I stupidly had the estrogen patch
In the bag.
stuck in the United States. Night sweats every
Oh, Lord.
single night. The minute the fourth day that patch arrived, I'm telling you what, no sweats
gone.
that night. It's like for me, it is instantaneous. And
I've had a lot of people
some
tell me like they
women,
can, because the patch you have to switch
Yeah.
halfway through the
No,
week.
I can tell
You
like
can
when
tell.
it's running out.
Mhm.
Oh, yeah.
Oh,
You
it's
can, for
crazy.
sure.
Yeah.
And
it's
I think I
wild.
just had a patch, to be honest, that didn't have the estrogen on it. She knows all about it. So, but I got some
Like
new,
where it got just maybe put in there
Exactly.
without actually having
because
impregnated
for
in
an
the patch.
entire 4 or 5 day span, all night, every night, and now I put the new one on yesterday. No
Yep.
night sweats last night. So it's wild
Yeah.
how well it
Yeah.
can work for people
Yeah.
that are having like severe symptoms.
And you've been a really verbal kind of advocate for other women to speak out and like not be a secretive, like shameful thing, which I think is great. Like you've helped so many of your friends.
Well, I just didn't know what to expect. So now I just want to shout it from the rooftop so people don't have to feel as bad as I did.
Yeah.
Because it just like ran me over.
Right. And your
Like-
posts are like, so, I read the comments and
Aw.
people are like, thank you
Yeah.
so much for
Well, the
saying
amount of
this."
people that have reached out offline is tremendous. Like the amount of women that I've already been able to help from my little Instagram following and my little network in Oklahoma and Colorado is really unbelievable. So to think like what you can do by just building this
And we-
women's healthcare.
Yeah.
Well, I guess you do both, men
we
and women.
do. I mean,
Yeah.
I do men, but like I would say like 75% of my practice is women.
Yeah.
And it's funny because it's not, I say this, it's not funny, but it is interesting that almost every conversation that I have with women between the ages of usually late 30s and early 60s it's a version of the same story,
Mm-hmm.
right? The symptoms might be a little different. The weight gain might have happened at a different time. But it is, and I tell my patients, I'm like, I'm not saying your story is not unique, but I talk to women every day. I have hundreds of patients now, and it's like I'm hearing the same story over and over, and I couldn't get help, and no one would listen to me. And I'll give you a great example. This is so wild. I went to a primary care, same thing where I was like, I need help, and it was male because that's all they had. And this was like beginning of perimenopause for me, so several years back before I was really doing this, really understood it. And he goes, I think you have bipolar type 2.
Oh yeah, that's
And I
what they
think you
told
should
me
go
too.
on Lamictal or another bipolar medication. And I said, I don't believe I have
no.
bipolar type 2. I've been a rock solid, stable human being for 44 years, and I left and I never went back. I was
Well,
like,
do you know how
"You're
many
nuts."
doctors I've had to fire? Oh, just for that reason. They're not listening to what the patient is saying, and
And
it's
they
not
think you're
their
nuts.
and it's not necessarily their fault. They weren't trained.
Yeah.
So
Well, there
now-
is a whole thing that is like they used to say it in residency, and now I'm like, God, that was so wrong and condescending. They would call it wacky white woman syndrome.
Oh yeah. Well, I'm that wacky white woman right here.
Well, I've always been a little wacky, but it's funny because I had multiple miscarriages, like I don't know, 6,
that's
maybe
a lot.
6. And my doctor here told me, well, you need, like, I remember feeling so sad and helpless and powerless.
Yes.
And my OBG here said, well, you need to have at least 3 before we consider this an issue.
Right.
And I took matters into my own hands and went to an endocrinologist in Houston. And literally, first visit, he goes, oh, honey, you just need some progesterone.
Yeah.
And then I had 2 successful pregnancies, no problems.
I wish someone had told me that, because I had 2, but what worked for me, because no one gave me progesterone, was acupuncture. Both times I did acupuncture from the onset, I was able to carry both babies. So I believe in all of it.
Yeah. And, you can get so stressed out about it. But for me, like, I never equated the fact that my body never produced enough progesterone. And I've always had horrible PMS. The week before, all my boyfriends always had an alarm on their phone that says, whatever she says, the week before that period, don't even listen to it. And what's so funny, since I started HRT, I'm on a very high level of progesterone. And I just thought to myself the other day, like, you know what? You have not been in a bad mood in a couple months. And it's like saving me. Like, I needed to take a lot of it because my body, I mean, even for the blood test to start registering it, it's taking 300 milligrams. So
which is a high dose.
Yes, which you have to kind of figure out the sweet spot. But it's like, oh my gosh, I have my life back, and I'm not having to live my life based on this calendar with alarms set off.
I wish I'd have had progesterone when
during
I
that
was
time.
Yeah.
That would have been nice.
You know what is interesting that you mentioned is, like, I have an almost 13 and almost 15-year-old, and I keep thinking it's nice to hear you say that, like, life is not over once they're out of the house, because I think about that every day, and it freaks me out. I'm like, what am I going to do when I don't have them at home to raise
You're going to be helping people all over
I know, but
town.
it's like,
That's what you're going to be doing.
were you fearful
Yes,
beforehand?
I mean, I wasn't fearful beforehand, but when they actually leave, it's like, oh my gosh, like, it's so quiet, and I'm a doer and a helper, and I'm a nurturer, and I have this dog, like, that follows me around. Thank God for this high maintenance dog, because it gives me, this purpose in my home. But the biggest thing is that you're just used to, like, coordinating soccer games and all the things, and it just goes completely quiet. And I did raise my children to be independent, and they are. And, it's
they're almost too independent.
They're too independent.
You did too good
I'm
of
like,
a job.
please, I'll make you a steak. Does anybody need money? Like, can you come by? And it doesn't work. They're in that phase where they're growing their own lives. But for me, the saving grace has been my business and building something. Like, that's when I realized
you have one too.
Yes.
Oh, yeah, all of us.
But that's been my thing. Not that you have to have a business to navigate this, but I have realized, and this has been part of my journey as a woman, it's not anything outside of me. It's caring for myself. It's the self-care. It's the building my business. It's the doing things for me. It's not about having the perfect partner. It's like when I finally learned to take the focus off the externals, my kids, they get into trouble. I got one that's always got some shenanigans going on, but I've had to learn that, like, okay, they have to live their own life. I'm here for them if they need me, but I have to take care of myself, and I have to, it's exciting for me to finally be to the place where it's like, wow, I can think about what I want in my dreams. And this isn't something that happens when you're 20. I'm in the space now where it's all clicking. Like, I know who I am.
Mm-hmm.
I know my worth. And then it's so sad to think that the shit hits the fan literally with your hormones. And so
Right when you feel that way.
right when you figure it out, right when you hit that sweet spot of being confident, being comfortable with your sexuality, all the things. Like, you don't care about the same things that you used to, which is very empowering. And that's why I just really want to shout from the rooftops for women, please don't ignore this. I watched the women in my family suffer my whole life. And all of them got hysterectomies because nobody knew what to do. So I didn't know who was like, when am I going to go through menopause? I didn't know because everyone got gutted, essentially.
Yeah, my mother, though, I asked her the other day, she's going to be 75 this month, because I was really curious, like, how was because it's usually similar to your mother, right? When you get period, what your perimenopause and menopause is going to be like, when it's going to start. And I said, Mom, can you tell me a little bit about this? She's like, oh, I have no idea. I don't remember. I was like,
That's
okay.
kind of how my mom,
all of
except for
them.
her frozen shoulder, was bad. And that was my first onset. Should have been my
Like
major
clue in.
red flag.
Yes.
But instead, I'm like, la, 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 everything will be fine. It wasn't fine.
And she had that.
She did, but she did not have any of this mental health stuff that I had, or that she remembers. There's no way you wouldn't have remembered if you needed to be hospitalized.
Right, true. But I feel like they were treated the way that, I was treated in that doctor's appointment. You're just nuts.
Everything's fine. You're
You'll
crazy.
be fine.
Yeah.
And such a high pain tolerance where it was almost like a badge of honor to like
To suffer
just
through.
suffer through it. And that's what I saw. Like, my mom was a rare case where when she had her tubes tied after her third child, there was a rare hormonal, like, it was a disaster after that. And finally, it took a doctor realizing she did need a full hysterectomy. And once that happened, she had adult acne, all the stuff, night sweats. And it's like, wow, there was so much suffering going on. And I'm even seeing the difference since I was so afraid of HRT. I thought it was going to give me cancer. And, it's nice to see that like women are starting to take charge. And
also, that there was an announcement
Yes.
a couple months
goodness.
ago that after 23 years, that study was misinterpreted and that the study group was not the right age.
right. Finally.
And that changed. A lot of people are now like, okay,
Right.
it's safe to do this and we should be doing it, because what we know also is that if you start it too late, it doesn't have any of the preventative effects. Like, it doesn't help prevent osteoporosis or Alzheimer's, or it's not cardiovascularly protective if you start too late.
Right.
So you have to start when the symptoms start.
Well, then some women that don't really have the symptoms still should be adding some of it to some degree, because otherwise they're not going to have any of the health benefits. But how do then they know how much to do if they have no symptoms?
I don't know a single woman
That doesn't need
in our 40s in town that isn't having some symptoms, like experiencing things.
It's whether they're willing to recognize if they're having the symptoms, because I think there's a lot of people that are just writing it off. Well, I'm so tired because I'm a mom and I'm busy and I'm this and of course I'm irritable. My kids are so annoying. And then
It's hard.
But they probably do, if they look really deep, have some symptoms.
I mean, I think this book really would help open some eyes,
Oh, I love that book.
Yeah. And from what I've learned just from working with a business coach, is something that she said to me is that women's intuition knows. And a lot of times it's just having the ability to bounce their questions off of another woman and be validated. And then they know that it's like women need permission.
Oh, yeah.
And once they have that, then it's like they set sail and they understand and they're open. And I think most people are really in tune with their bodies. But, before I just didn't even know that this was part of the equation. So this is why we have to talk about it. I was just talking to a woman and she was complaining about her hair falling out. And I just happened to say, have you thought about this could be hormone related? She's doing all these other things, spending so much money
Like on supplements and like.
Yes,
Yeah.
and not even thinking that it could be perimenopause. So
And she can get HRT with insurance, most likely.
exactly.
Yeah.
So this is just, it's kind of like just spreading the word and giving women permission and taking the shame off of it. Like, whatever, I've gotten over that, but it was hard, like it's like, I don't know. I rather feel good than be embarrassed.
I think a lot of the stigma is going to fall away. I mean, if you think about the GLPs 3-4 years ago, no one wanted to admit it.
Right.
Right. And then Oprah got on TV
Right.
and talked about it. And
Well, I still have friends that won't admit it. And I'm like, why don't you just admit it? Everybody knows what's going on. It's like, you should be proud that you're taking care of
Yeah.
your health.
Yes.
And like,
this is a medical treatment. And what I always say is HRT, the GLPs, these are medical treatments. They're safe. And instead of it being a Band-Aid, because so much of what we do in allopathic medicine, which is like straight up MD, right, is putting a Band-Aid on a problem. Like you have high blood pressure, you get a medicine for life. You have diabetes,
instead of diet,
you get
exercise,
a medication
all the
for
other
life.
things.
Mm-hmm.
And this is a different situation. We're fixing a problem rather than bandaging
Yes.
a problem, which is just completely different than the way I was trained, right? I wanted to bring up how you and I met because so Lindsay, 12, 13 years ago, I think I was pregnant with Catherine.
Yeah.
We started looking for a property and we went through maybe 10. And then she was like, there was this off-market house with these little sweet people who the woman's still alive. Jason just picked her up off the ground the other day. She broke her wrist in the front yard. She couldn't get in her car. But they're still there. And she's like, write them a letter. Just say, this is where we want to raise our family. We're not going to turn this house over. This is what we want to do. And they executed. And she was like, holy... You said something else. But
I can't imagine what she said.
We couldn't believe it. And so, I've watched your career over the years and, you went out and created something. And I think I didn't know I could do that, right? It took a little bit of, I was scared. Like, is this going to work? Is this just a stupid idea? Men don't feel that way.
I know.
Right?
No.
Like they just do it. They don't ask permission. And, one thing that, I've been, like you said, I've been married for 17 years. My husband's an MBA type, and he always said to me, if you don't ask for it, you're not going to get it. And we as women are so afraid to ask for things. And so I think that is, it's just part of how our society raises up. We're afraid to ask questions, to ask for things. And then, like you were saying, you get to a point where you're like, don't care anymore.
Yeah.
Like, it's just time to do something different, something that's better for me and for my family. And so you've been an inspiration because
Thank
I've
you.
seen you do it.
Thank you.
And I was a little terrified. Not anymore, but...
And that's the blessing of middle age too, is that a lot of the stuff we really just don't care about anymore. So it empowers us in that way, that we're tired and we've seen it all. And it's like, okay, who cares? Also just, becoming more comfortable with our bodies. But something I want to say, when you were talking about your children and being an empty nester, we're all mothers here. And, I got a divorce when my kids were 7 and 9. And a lot of times people who are unhappy in marriages will stick together because they think it's best for the kids. And there was something in me that understood that if I was happy, that my children would be happy. And it's been so interesting. So that's one thing, is that I always tried to model, like, if I could just choose myself, then my children would have permission to choose themselves in any situation. And being a working mother and having my own business and slinging everybody around. And, I used to make spaghetti sauce, spaghetti out of the jar. And my youngest would always tell me that I was just the best cook that there ever was because he understood, like, in his mind, I was the greatest mom, doing what I could to make it all work. And me following my dreams and my passions, is the thing that has given my children permission to do so. So it is
Mhm.
not about being perfect. It is not about giving them our undivided attention. That's all bullshit. You know, the mom guilt, all the stuff. It's like really choosing yourself and following your dreams is how you allow your children to do the same. So I just need to say that because, you know, we just deal with so much extra stuff that men in our society don't have to deal with.
Not at all.
And none of it matters because a lot of it we just create ourselves as a way to keep ourselves small. And I don't know what it was. My mom taught me a lot of things that she didn't even practice herself, but have my own money.
Yes.
You know, she's like always said, think like a man when it comes to decisions that you're making. What would a man do? And so it's just, I get excited. That's what the feminine grit is about.
Yeah.
Like talking, you know, Kristen and I have navigated this space as entrepreneurs. There's a lot of magic that happens when a woman finally has the courage to do what she always knew she could do anyway.
And you know, my mom said something similar. She is a therapist, and she had her PhD, but she wasn't practicing and my dad left right around when I was 11, and so she really wasn't working, and she had to go out and build her own practice to support us, and she was gone a lot. It was tough, but she did it, and she's still practicing even at 75. And she would always say, get a good job, make sure you can support yourself, do not be dependent on anyone, man, woman, or in between. Like, that was her, like, constant message to me. And, you know, I went out and did that. So I say the same thing to my kids. I'm like, I don't care what you do if you have a passion for it. But you gotta have to grow up and support yourself. And that could be a vocational thing. It could be higher education, which is what my husband and I chose to do. But just on that note, the other day, I was talking to my accountant, and he was talking about, he goes, you know, I went to law school. I'm an accountant. You're a doctor. Your husband's an MBA. He's like, but the guys that pop dents out of people's car make more money than you. And so I'm like, if they want to do something
Not wrong.
vocational,
Yes.
then
And then start
that's
your own
great.
business.
Yeah.
Don't just be the employee.
Right.
Start
Start
your
your
own.
own dent popping business.
Yes,
Oh,
exactly.
that's a
like-
plug for my friends in Denver. Precedent.
And I mean, he's not kidding. He's like, this is what they're doing, and they're making more money than you are. And I spent 30 years trying to go
Right.
get to this goal, which is what I wanted. But I'm like looking at my kids, and I'm going, you do have other options, but you have to be able to grow up and support yourself.
Yes, and just like also, you know, the baby boomer generation had a lot of fear that it was all about like you got to have all these things in place, and you can see the younger generations coming through the ranks figuring out creative ways to make money.
Oh, they are so much more creative.
Yes,
Yeah.
it's insane. So it's like the thing about it is that freedom, you know, you don't have to have a ton of money, but living within whatever means, but that is ultimate power, is just knowing that you can take care of yourself.
Exactly.
And that's all I've ever tried to tell my kids. My youngest is not he's not going to college. He, you know, he can fix anything. And I'm like, follow your bliss.
Start your business.
Yes. Yes. So, you know, this whole thing, like you being brave, and I don't know, what was the turning point to finally do this? Had you been dreaming about it? No? Okay.
I
So
was scared to death. And then I can't talk a whole lot about it, but it started out as like working for somebody else. And it was a man. And it didn't go well. And I figured out that I could do it better on my own. And that's when, you know, I split off and started my own thing. In June of 2024 is when we split. But what I will say about that relationship is it taught me that I could do this, and I could do it better and smarter, and that, you know, people like my bedside manner. And like you were asking, how did this really get going to this level? It's been word of mouth. It's been like, I love her. You got to call her. She'll help you.
Well, I've sent so many of my friends just because you listened to me.
Mm-hmm.
and you didn't write me off, and you were just like, yes, I can tell you know what you need. Let's try this. And then
Yeah.
there
Yep.
we go.
I spent a lot of time listening to people. So if you look at like my booking, it says 30-minute.
But really it was an hour and a half.
Yeah.
Mhm.
It's never 30 minutes.
Yeah, I can
It's-
speak to that.
It's
Mhm.
always like, especially
But you're
in the
worth
beginning.
the money, so you do have to charge people.
But I also like, I like having those conversations because then you get to really know your patients, and they send me pictures of their grandkids or their
Oh.
garden or their whatever
Right.
it is.
Right.
Or they say things like, I had to go buy all new clothes,
Mm-hmm.
and it's the best feeling, and I've never thought I could feel this way
Mm-hmm.
ever. Or like just that kind of feedback,
Mm-hmm.
which in the ER you rarely get. People are not there because they're happy or well.
Mhm.
You might once in a while get like a little card that says thank you, or maybe a box of cookies, but that's maybe like once a year.
Right.
In this different kind of model of practice, you get that kind of feedback all the time. Like, you helped me so much. Thank you for listening. And
Yeah.
also my capacity for listening has changed as I've become a mother and gotten
Mhm.
older. ER doctors notoriously have short attention spans.
Mhm.
So,
Well, that makes
something you
sense.
work on.
Yeah.
you
We're
know?
all working on that.
HRT has helped me
Oh,
become
yeah.
a better
And
listener.
creatine helps a lot as well.
My husband takes that.
Oh, yeah.
But yeah, it's been
So then how did you decide to break up? Like, you broke off alone, or you got
no.
together with several other women and said, let's do our
I
own?
had been hired, with this other person, and then it wasn't working out.
Mhm.
And we'd brought in my current partner,
Okay.
Dr. Levitt in Houston. She is also ER trained. She's been practicing for maybe 16 years. She's a little bit younger than me. But her brother and my husband went to Vanderbilt together.
Oh, okay.
And so they had lunch, and her brother's like, "How do you look so good?" And he goes, "My wife." And so they started talking,
Mhm.
and he said, "Oh, she's got to meet my sister." So she drove up from Houston. We had a
Wow.
meeting, and she thought about it for a month, and then she's like, "I'm in."
Mm-hmm.
And so we co-own it, and
So you're the two founders.
mhm.
Okay.
And then we, like I said, we have several other doctors and PAs and nurses. And the hope is to expand again this year. I think we will.
Mm-hmm.
But it's a very female-driven company. Like,
We love that. That's
We
why I
have-
send all my friends to you.
Mm-hmm.
we have, our husbands who we call the CFO and the COO, or unpaid interns. And
Oh, yeah. My husband's been an unpaid intern
for years.
for my whole real estate
Yeah.
career.
And then we have, a male PA who I love, who I worked with in the hospital, and I adore him. People
Mhm.
adore him. And we have a male doctor, and the other 10 people that work for the company are all women.
Mm-hmm.
So very female driven.
Yeah, and women are taking care of the world, so they advocate for everyone that they love, which is often their husbands or their partners or kids, whatever. It like brings it all in.
Well, and then the aging population is also typically the decisions are being made by the female.
Yes.
So I forget the stat, but it's huge. The amount of women that are making all medical decisions
for their
it's like
aging parents.
75% or higher.
Mhm.
Yeah, I mean,
Yeah.
I did for my father before he passed in August. And then my best friend from college just texted me the other day and goes, "Will you be my MPOA?" And I was like, "Well, that's gonna be rough for me, but okay."
Yeah.
I mean, it's not just that she's married,
Yeah.
right? She got a husband, but she's like, "Will you do it?"
Right. She wants someone who's going to take care of shit. Get
She
shit
wants
done.
to make sure that like she's not like that her wishes are listened to.
Yeah.
And what my other friends this weekend, we were all joking about, they're like, "Well, can you be ours?" Because we know that
Well,
like,
there's another side business for you.
I was like, I mean, as your doctor, if you want me to do that, okay. But
Just don't all die at once.
please, I need you. But it's also important to have like, you know, a group of friends around you that can talk about things like that sound fairly morbid, but they're real
Yes.
issues,
Yes.
right? And that we have to think about. And I've got some funny friends so that can talk about anything. And that's been really helpful. Just, you know, and then they've spread the word.
Yes. And that's the other key to navigating that empty nest is making sure you have your girlfriends in
And
place.
hobbies.
Ooh, yes.
Hobbies.
Yeah. It's also like, I also realize it's a small time frame because then my kids will have kids and
Right.
like there'll be more added back. But this like women empowering women and just those relationships, because oftentimes that's why men need us so much, because we can communicate and talk about these issues and we care about solving them and digging in. So we really have always been advocates, but less of ourselves. And so now it's time to advocate for ourselves so that we really can. It's like putting your oxygen mask on first so that you can help other people.
Yeah.
So that's where, that's the whole point of this. And thank you for saying that about me helping you so many years ago, because I've always like, you're just a person who cares and you're so smart.
Thank you.
Like that's the other thing is like women often don't acknowledge how smart they are. Like we can do anything. It's like, give us a challenge. We have the most reservation when it comes to our own businesses and our own confidence. But if it came to like saving the life of your child, you would never even hesitate. It's like, I don't care what's going to happen. I'm doing this, so like
Mama
if we,
bear.
yeah, mama bear, have the mama bear towards, we need to have that towards ourselves. And it's like problem solved.
I think it's so funny. This is a funny little story that happened a long time ago, but it was when we just finished building the house. And in our neighborhood, we used to do First Fridays where a different family would host. That's kind of gone away because the kids are older and everybody's got sports and a million things going on. But most of the time when, people say a kid or a person is choking, they're not actually choking. I'm standing in the front yard. I'm holding someone else's baby. And one of the moms is like, my son is choking. And I'm like, surely not. Right. And so I look over and I'm like, oh.
He actually is joking.
So I handed the baby to whoever was next to me. She carries him down. And he's too big to do, put over my knee because he's like a 4 or 5 year old, but he's too small for the Heimlich. So I just grabbed that kid in front of like 20 or 30 people in my front yard and I whacked him.
Yeah,
and I whacked him and I whacked him and it flew out and then I hit him again for good measure because my adrenaline was going. And then he was fine. And then I took the baby back and everybody was just like, what just happened?
Not all superheroes wear capes.
And my husband was standing next to somebody and he goes, I don't know if she's doing that right. He's like, I think she's got it.
I had to do that for my son multiple times.
Terrifying,
Yeah.
right?
Oh, that's amazing. Yeah, jumping into action.
And then just taking the baby back and
Yes.
like continuing to have the conversation. Everyone in the yard is going,
Well, because you're an ER doc, of course.
it just kicks in.
Yes. It's the mama instinct.
Yeah.
Yeah. It's
Even
amazing.
when it's not your baby. So I just think I thought it was so funny because everyone was like, shouldn't we take a minute to like process this?
We're like,
I'm
no,
like,
he's fine.
no, he's
We
Get
got it
this
all
party
out.
started. Yeah. So this whole space is amazing. And I know your business is going to continue to grow, especially like I love being able to share your story
Well,
with
thank you.
people. There's so many eyeballs watching all the time on social media. I know that the space is going to continue to change. I know for me personally, like I have great insurance, but like we talked about, it's so hard for me to get a doctor's appointment. I've had to turn to cash pay stuff just to get it in a timely manner. But just like with my food, I will spare no expense when it comes to my health and my care. So I think there's lots of women, it's like not even an issue. Like they just want the best care. So the other piece of this is just helping women understand so they can navigate their medical community and know what questions to answer.
Yeah.
And, I just want to speak to the women out there who are listening, like get a second and a third opinion, trust your instinct, trust your gut, read the books. Like there's so much free information out there. And then you can help your doctor figure out what's wrong with you.
And I would add, if
But
they're
not
not
everything's
listening,
wrong. Let's preface
Okay, well, I shouldn't say that, but
that
how should I
maybe
say
treat
that?
your symptoms, but there's nothing wrong.
There's nothing
It's
wrong
all
with
very
you.
normal.
Yes,
Yes.
yes.
but also if someone's not listening to you, they're not the right
Exactly.
person for you. And you have to be able to say, hey, yeah, I disagree. Like, one thing I want patients to know that I think doesn't get said enough is that healthcare is a consumer product
Exactly.
and you are the consumer. So if someone's not listening to you or they're being dismissive, you don't have to stay.
No, you don't.
And so patients have to advocate for themselves. You write everything down. It annoys some doctors to no end, but you take your notebook, you write down everything that's said.
Or you just ask if you can record it.
Yes.
Yeah, either
Or
one.
don't ask and
But
turn it
you
on in
know,
your
like
pocket.
just you have to advocate. And a few times I've been on the patient side of things. I got appendicitis about 5 years ago. Terrible experience. Don't wish it on anybody. And then I had a birth complication with my first child, and ended up back in the OR after I had him. It is terrifying, and it is like so difficult even as a doctor to navigate that. Like, just simple things like when I was in the hospital for my appendicitis, I thought that I had a viral GI syndrome because it never turned into like what you typically hear, which is right lower quadrant pain. I had some of the typical symptoms, but it just was like this kind of band-like thing. And I was like, it's probably just a GI thing. So I went for 3 days, which was not good.
That's a long time.
Yes.
And then I worked a shift, and I worked that shift. That day I got sicker and sicker and sicker. And by the time I signed myself in, I was still working, got the CT scan. I was like, oh, no, this is not good.
So emergency
then
surgery?
Finished my shift at 2 p.m. and called the surgeon walked upstairs, and I said, I'm here for my appendectomy. But it had been for 3 days. So
you could have died.
Mm-hmm. And
my
it was
gosh.
complicated, and he ended up having to do it open, which my best friend's an anesthesiologist in Virginia. She's like, Ann, in 20 years, I've never seen an open appendectomy. What the heck? And so then, I was in the OR for 5.5 hours instead of 1.5, and came out, and I looked down, and I was like, what just happened to me?
No. You're just as stubborn as the other two of us
I
in this
know,
room.
but I really, truly, and part of that I will say is I have ulcerative colitis, and I was in the middle of a flare. So I actually did go to my doctor,
Right.
and they're like, you need to go back to your GI doctor. There's nothing we can do. This was Monday. The surgery was a Wednesday. So I did go to the doctor.
You did do all the...
And it was just misrecognized, it was undiagnosed.
right.
So, but like when I was in the hospital, my IV was in my, the crook of my arm, which is not the greatest place because you move a lot there. And I kept begging for them to change my IV because it kept, I was getting constant antibiotics and it kept occluding. So then the machines would start beeping and hospital is a terrible place. You can't sleep there. They bug you all the time, every 4 hours. Like I'd say, could you just bundle the labs and the meds and just come in less? And they wouldn't. And that's their job. They have to do what their, job description is telling them that they have to do. But it was very difficult. And I was like, God, this stinks to be a patient. Like, you cannot sleep. How are you supposed to heal? And then finally, the nurses were afraid of me because I'm a doctor working there. And I say that with all the love in the world, I would be afraid too. And I kept begging to have my IV changed, and they did not want to do it because I'm, who wants to do that on a doctor?
No one.
Right.
And so finally, I just called the ER charge nurse.
Finally, she did it herself.
I go, well, I would
She's getting at.
have, but I was too sick at that point. I called the charge nurse, and I was like, can you please come up here and help me? I need a new IV. So she came up and changed it out for me. But like, even as a physician, it's hard to navigate.
Yes. Yes.
So
That's what I learned from my whole experience is advocating for yourself. And if you don't feel right, then something's not,
Yes.
I don't want to say wrong, but something's off. And you need, and like, I had no idea how much I would have to advocate. I thought like, oh, everyone's going to be able to help me because they're a doctor or they're trained in this. But really it was all self-education. And then even with the education that I'd taken upon myself between podcasts and books and talking to friend after friend after friend, I still had to fire multiple doctors
Yes.
to finally get to you and my OB in Denver that would listen. But it took 14 months, and I had a lot of knowledge.
I think there's a
within, like-
lot of burnout in the
Yeah.
medical system. It's going to get worse.
Yep.
Yeah.
And that's the other reason that I think the concierge model is going to be helpful for a lot of people, because what we haven't talked about here is, and we don't have to get too political, but there is a bill that was just passed that is going to cut off a lot of places, a lot of people from Medicaid. And there are a lot of rural hospitals, especially places like here in Texas, where those rural hospitals are hanging on by a thread. So just to give you an example, St. Mark's hopefully is reopening in Elgin or LaGrange, but it closed 3 or 4 years ago. So there's no hospital anywhere near those people. And so when I was working out at Smithville, they would drive 40, 45 minutes to that tiny ER to get care. And that's going to keep happening with these smaller hospitals that are just on the brink of closing. And then what happens with those patients? Where do they come? They drive to Austin. We're already overwhelmed. We're a city of 3 million people in the metro, and we haven't built a new inpatient facility since 2009. So it's going to get worse.
Wow.
Which led us to another question we had of what do you see, where do you see this line of work going in the future of the telehealth space and the concierge
I think it has
medicine?
to grow, because the other thing, there's several things. Like I said, there was a lot of attrition across professions after COVID or during COVID. People were like, I don't want to die. I've got little kids. I'm old. I have kids with special needs. Like, they found other things to do. And, you know, there is also something in that bill that limits the amount of money you can borrow to $150,000 of federal money. Do you know how much med school costs?
Yeah, that
Hundreds
doesn't
of
make any
thousands.
sense.
So that means that then if you want to go to med school now, unless your parents are rich, you're going to probably have to take private loans at very high
which are
interest rates.
Really high rates,
Which I was super lucky, because right when I finished med school, I was able to consolidate my loans. I didn't take very much money out, because my med school, I went to VCU in Richmond, and they had a sign on the door that said, "Live like a doctor now, live like a student forever." So they made us live it like under poverty level. I'm not kidding. But it was brilliant, right? So I didn't end up borrowing much. And then the last year that I was there, was able to consolidate at like a 2.5% interest rate. So that's not going to be possible
No,
for
that's
people.
not possible.
And so I think
So you think
going
it'll
to
just keep
discourage.
expanding the telehealth world?
I think that's going to have to happen. I think, you know, if less people go to med school because of these issues, and I think that will happen. Because the compensation, if you've got $500,000 of loans and they're at high interest, it's, I mean, unless you're a neurosurgeon, like, I don't know.
Right.
What are you going to do?
And the cost of insurance has gone up, so it's just like everything is.
We've had a ton of attrition in the EM world, but we also have had decreasing numbers of graduating med school students wanting to go into EM. So that's also going to be.
Is that because of the hours?
No, my couple things happened. One is, you know, we kind of look like I'm from West Virginia. I'm going to use a coal analogy. We kind of look like the canary in the coal mine, right? We're sitting there, sitting ducks during this really scary pandemic. And I think that was a turnoff. Like, you're the first line. You can't work from home. You have to be there. The other thing that happened right before this massive pandemic that we didn't know was coming was the fall of 2019. The academic emergency people who always advocated for starting fewer residencies to not pump out too many ER physicians. And ASEP, which is our professional association, who'd stayed pretty neutral between the corporate medical groups and
Mhm.
the academic groups, finally they put out a letter that was basically saying that by 2030 there'd be 10,000 too many ER doctors for jobs. Now, if you're a med student graduating, you're like, I'm not going into a profession where I
Right.
can't get a job.
Right.
Well, then COVID happened and
Mhm.
blew up the whole system. And so, whereas we went from, 2030, we're going to have 10,000 too many jobs, it's incredibly difficult to staff ER doctors.
Yeah.
Like, I get texts every day from all over the country begging me, please come work.
Mhm.
We need
Yeah.
help.
Mhm.
So,
That's kind of scary.
Yeah, it's crazy. I hadn't even thought about that whole side of it, which it's like medicine is going to have to become a business in order for, people to be able to afford it, like hospitals and
I mean, hospitals are already, they already cost shift,
yes,
right? They cost
yes.
shift to insured patients, and
Mhm.
they have to do that in order to stay open and operational. But I think the thing that scares me for people the most is this idea of like all these small hospitals closing that are
Mhm.
serving smaller communities.
Right.
And then they have to come into Austin or they have to come into Dallas or they have to go to Houston. And we're already in a fairly overwhelmed
Mhm.
healthcare state in most places. So that's just going to make it harder.
Yeah, exactly.
So,
Well, tell us again. I just want to make sure it's clear how people can find you and find
sure.
out about you.
So we have a website. It's Amanecia Health. So it's AMANECIA health.com. If you're looking to book in Houston, that's going to be Dr. Lauren Levitt, and then Lizzie Devlin is her PA. And it has all the locations.
Okay.
It has our pictures. You can click under our pictures that
Mhm.
say book now. If you scroll down the website on the phone, our pictures are on there, and our book now button is right
Great.
below it. And then there's a phone number. And if you call that phone number, it's going to come straight to me.
Mhm.
And it's going to say on my phone, Amanecia inbound, so I know it's a patient
Okay.
rather than a personal call.
Great.
And then our list of services is on there. It's pretty easy to navigate. It's also ADA compatible. So if you have a disability, like you're blind or you're deaf, we have accommodation for that
That's
as
amazing.
well. Um, if your friend refers you to me, just call me.
Mhm.
We'll have a conversation.
That's wonderful.
I know. I was wondering when you were going to tell me I couldn't share your phone number anymore.
Never.
Not yet. Okay.
No. It is something that people are not used to. Like the other day, I had a doctor's office calling because they need some notes for a patient that I referred in. And I answered, and they're like, "This is who?"
You're like, no, I
And
promise.
then it's Dr.
This is Ann.
Czarnik. And she's like, doctors don't answer the phone. I was like, this one does.
Yes, you
So,
do.
Yeah. So
Oh, I
it's
love it.
definitely
You're
different.
changing the landscape,
Mhm.
and it's
I hope
well
we
needed.
can.
Yes.
Yes, and just caring and getting people what they need. That's how your business is going to grow, because I know that, like, when I know someone that really has my back and listens to me, like, I'm going to spread the word from the rooftops. And that's the way that especially women work.
Yep.
You
And
know,
that is how it
Especially
is
women in
100%
this
grown.
phase.
But I will say,
Yeah.
I do listen to my business husband's advice as well. And one of the things he said, and everyone has said, is you do need to do some SEO, which is basically search engine optimization. So your page pops up higher when someone searches certain terms.
So are you hiring that
We
out?
have hired that out, and it's starting to get some traction. I always ask people when they first talk to me, I'm like, hey, can I just find out how you got to me? Just out of interest. And also it helps me know, like,
Yeah.
is the website, is the SEO actually
Yeah, like what's working.
doing anything? And he had said he and his wife were interested in some of the things I provided, but they felt very uncomfortable with going online without a doctor. And so they searched and found me and decided I was what they needed. And so that's like one of the first like internet
Yeah.
So
search
most has
pages.
been referral.
Oh,
And you
yeah.
have
yeah, I've had
Just
two
now starting
people,
to get, yeah.
two people so far. But, you know, SEO also takes a long time.
Yeah.
And we only really seriously started it like 3 months ago.
Mhm.
So the rest of it has been 100% word of mouth, which is actually great because it doesn't cost anything to advertise in that
Right.
way.
And people are more trusting. It's how my business in real estate has
Mhm.
always worked. When you get a referral, it's a more trusted lead.
Yeah,
And
if you say, hey, this person's great, like
yes,
they went to bat for me, and you certainly did for us.
yes,
You're right. It's like the client or patient comes in already with this kind of like sense of, okay, I know this person's coming back.
right.
So
Well, just to wrap up, I always like to ask, is there, like, if you were looking back and, you know, talking to a woman who maybe wants to start her own thing, or like, what advice would you give her?
so I guess I would say make sure that you have the right team behind you. And that can mean like the SEO people that we're using, or it can be like you know, if you have a spouse or a person that can, you know, do some of the things to help you that you don't understand how to do, don't be afraid to ask. Um, and I guess just the biggest thing is like give it a go. I mean, if you don't try, you're never gonna know. And it could turn into something magical. Like, I think I can talk about this because it's already happened. But like, are you familiar with Her New Tribe? It's a jewelry company.
No.
This is a friend of mine's jewelry company, and she started out doing pop-ups around Austin, and then she just went on to Nordstrom
Mhm.
online in November.
Oh, that's so cool. What's it called?
Her New Tribe.
Okay.
And you know, she just started making jewelry in her house and went for it, and
Mhm.
it's grown into this giant thing that's now in Nordstrom, which is
Yeah.
huge.
That's awesome.
You know, so
Give
that's
it a
what I would
go.
say.
Give it a
Give it a
go.
go.
Yep.
Try
And
it.
if you don't ask, what was the other takeaway?
That, you know, men are not afraid to ask for
Exactly.
anything, and if you don't ask for it, you're not going to get it.
My
Yes.
family's always told me that I'm really good at that.
Mhm.
So I don't know. Maybe I'm sure my parents must have told me that as well.
Yeah,
Because I've always been
but
asking.
that was
'Cause I don't.
more like I would say that was more when I came out here, and no one had taught me that very well. But I remember getting that lesson very clearly, not because my husband was trying to be a misogynist, but because he's like a man and this is
Yeah.
what men do. And I remember when we first came out here, they would go kind of make you work in some not so savory places because they wanted to make sure you were going to stick around. And so I was going up to Colleen, Metroplex, and I had been the interim medical director there, which was not an easy job. And then I got pregnant with my son. And so I said, well, I've been doing this for 18 months. And if you don't, you know, I told my husband, I was like, if they don't bring me into town by the end of the year, we're quitting, we're finding something else. I can't keep doing this drive. I'm going to have a baby. And he goes, tell him that.
Mhm.
Tell him I'm 15 weeks pregnant. If you don't bring me into town, I'm quitting. And I was like, I can do that?
And I bet you had a new job in town the next
Immediately.
week. Yeah.
Immediately.
Exactly.
Not even the next week.
The next day.
Yes.
I was like, we'll get you down here.
Yes.
And I never in a million years would have done that had he not said, just ask.
Yes. And the other
And
thing,
it wasn't even just ask. It was like, tell them.
yes,
Right.
tell
This is
them,
what is
advocate for
going to
yourself.
happen.
Yes. And you know, I learned from watching Oprah every afternoon my entire life. She always said, don't ever take a no from someone who's not authorized to tell you yes. That was the other thing. Like, find the
Like,
person who can actually help you. Don't take it from the person answering the phone. And you know, it's just always amazing what happens when you just ask for
Yeah.
help.
Yeah.
So I think
I love that.
Yeah. I think that's a perfect ending to this.
So thank you so much for having me, and so fun
we're
to
so
see
happy
you.
for your
Yes.
business and what you've grown and
Yes.
what
And to
you're
see
gonna
what
continue
happens,
to
it's
grow.
going to be very successful.
Thank you.
Yeah.
I think the other thing, the last thing I would say is there is also a sense of, you know, for me, anxiety about that, right? And so I've got a husband who's always like, you need to calm down. everything's going great.
Mm-hmm.
Like it's growing. But that also drives you, right?
Mm-hmm.
To never feel like complacent. Like you have to keep building. You have to keep out, doing more. So he helps me calm down, but I also have this very strong drive to grow this thing.
Yeah.
So,
And again, it goes back to what you said about having the right partners and knowing that
Mhm.
you can delegate and knowing you can stay in your lane and,
it doesn't have to be a spouse. It could be a best friend. It
Exactly.
could be anybody you trust or that has expertise that you feel comfortable with.
Yes. And you really are like, you love to help people. You always have been that way. I think that's the part that's, you just continue to let that be your driving force and everything else is going to,
Thank you.
yeah. So thanks. Thanks for being on
Yeah,
the podcast,
yes,
Ann.
thank you.
This is awesome. Thanks,
was fun.
Kristen.
Oh, yeah. Well, we'll see.
No, I'm so glad you came down.
That's a
and
wrap.
Got to meet you.